typical person might be a middle-aged woman who was put on a medication during a divorce. She's been on it for maybe 15 years or so, and she's starting to notice that whatever she does with the medications, it's not working. She's gone up on the dose, she's maxed out, she started a new one, and she just feels terrible. She has brain fog, she has low energy, and she feels numb. And she's realized essentially that, psychiatry has kind of failed her, that the answer to her solutions aren't really drugs anymore. And so she'll come to us in this state. And what we do is we look at the drugs she's on. Usually she's on several. And then we'll just start to identify which drug is most likely to be causing a problem. The most amount of your problems, and we start there and we slowly taper that off. Some drugs you can taper quite quickly, others can take years to come off, like things like benzos and SSRIs. They're much harder. And so we'll work with patients for several years, slowly untangling the medication regimen, meeting with them very frequently until we ease them off. At the same time, we introduce them to non-drug approaches to managing their mental health. If they need to do dietary modifications, lifestyle changes, if they need to learn some sleep, if we need to look at some of the substances that they're using, we'll use all of our non-drug tools while we're bringing them off the medications.